Welcome to the Java Cafe, Java fam. Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everyone. Good morning. Good morning. If you're tuning in, you're like, James, you're blue, no red. As we do every other Tuesday, thanks to the support from the Massachusetts General Hospital Office of Equity and Community Health, we are here this morning with another episode of Your Healthy Java. As we are approaching Black History Month, we are talking with the Vice President of the Office of the Office of Equity and Community Health, Dr. Joe Betancourt. We're going to bring him in a couple of seconds, but I'd like to bring in my friend and your trusted medical director here in the Java Cafe for Your Healthy Java, Dr. Claude Alabre, and it's good to see you in the room this morning.
It's good to see you as well, Jimmy.
How are you today?
I'm doing well, thank you.
That is good. That is definitely good to hear. And so you and I and Cindy Diggs, who is taking some R&R and self-care this week, as many of you need in this industry, we talked about this subject of health equity. And I think it was a consensus. I'm pretty sure it was a consensus that we would invite Dr. Joe Betancourt to come talk with us about health equity. And so please give your spin to why it was important to have him in the room. And then we're going to bring Dr. Betancourt in. Dr. Alabre is going to be in the background doing some work. And then we're going to bring him back. And we're going to talk with him about his passion about health education. And it ties so together from health equity and awareness and education. So floor is yours, Dr. Alabre.
Sure, yeah. I mean, there's always a good time. I guess it's always a good time to talk about equity, but especially today, I think we had this discussion about Martin Luther King Day and the day after, what it all means, and Black History Month coming up. And obviously, this is something we know we're not there yet. There's a lot of work being done for equity when it comes to health. But there's still a lot of work remaining to be done. And so we also want to make sure that people understand what it means. What is equity? What is health equity? And I'm sure I'll let you guys get into the discussion, but I'm sure that's going to get covered in terms of, is it the right thing to do? And we strongly believe it is the right thing. It's the right movement. And there's a lot of movement out there at all levels of people looking to really make sure that all our citizens are treated equitably, not just equally. There's a difference. And so
there is, and we can get into that with your perspective on that in just a few moments. But it is my honor and privilege to bring back into the room. He was with us via video on October 26th, our first day where we launched Your Healthy Java, a segment here in the Java Cafe. And it is a privilege. And Dr. B, I'm just going to give you a few bells and whistles. But Dr. B, welcome. Dr. Alabre, we're going to be back with you. And don't forget, folks, some of the information that Dr. Betancourt is actually going to share and a real premise and tenet of Your Healthy Java. We're going to get some updates from Dr. B before we talk about health equity, which is so important in the context of the coronavirus and vaccination. So we're going to start with that. You two say hello, and Dr. Alabre, we'll let you go and do what you need to do, and then we'll bring you back in when Dr. Betancourt finishes. But you'll be able to ask questions toward the end of the segment. So go ahead and say hello, and then we'll jump right in, Dr. B.
All right, great. So first, props to you. It's my honor and privilege to be here. This is, my favorite partnership, and been tracking you all and this work bringing information to the community. So this is just the beginning. We're going to grow, we're going to learn, we're going to expand. And so super excited to be here, super thankful for Claude and this partnership and this leadership. And we're going to keep doing it. We just want to be here, Jimmy, and be available and accessible and give people the information we need. And this, your platform has been amazing, growing. So it's my honor and privilege to be here.
Thank you, Dr. Betancourt. And Dr. Alabre, we're going to let you go. And so we can jump in, because one of the things that Dr. B wanted to do, and again, a foundational education component of your Healthy Java, is updating our community about coronavirus and the vaccination. So Dr. Alabre, we'll be right back with you, sir.
Sounds good.
All right. Dr. Betancourt, it is, I know what you said about the honor and here and whatnot, but this is this platform. We're here because a couple of years ago we met. Shout out to Cindy Diggs, who's doing some self-care. And we talked for quite a few months, and we're here today. And it is really based, sir, in MGHs and your understanding of the importance of health equity. And equity has never been more important than it's been in this world pandemic. And so let's talk about where we are with the virus, sir. There's the variants, there's Omicron. And so the floor is yours, sir.
Yeah.
I'm honored to have you here. I feel like I'm in a lecture in the Ether Dome.
No, man, we're just today's about keeping it real. I'm just thrilled to have a conversation. I just say, we can't talk about equity without talking about where we are with this pandemic, right? So I just want to be clear about that, and I just want to make a couple of quick points. And I also want to say that, what I'm I think proud of is that we're not new to this work, right? There's a lot of people who got religion on equity and racial justice in the last year and a half. And there's a lot of people who tweet about it, on yesterday's holiday for years and years. And this is hard work. It's never enough. There's an urgency of now every day, and that's what drives us. And so, we're always trying to build and trying to figure out new and creative ways to do this work. And so, I think if there's anything I'm proud about, sure, we're doing cool things and I'm excited about them. But, we didn't just all of a sudden find out that equity was an issue, in the last 2 years, like many have. All good, more the merrier, we're on board. But just a couple of quick points about COVID, because, again, I think it's important for us to lead any conversation about equity. Talking about equity in diabetes or other things is not, relevant if we don't get out of this situation. So a couple of quick things. First, you all know we're in the middle of Omicron. We know that Omicron is more contagious. We know that it's less infectious if and when you are vaccinated and boosted. So if you're vaccinated and boosted and you get Omicron, you're going to have no symptoms or maybe mild cold symptoms. If you get Omicron and you've gotten your vaccine but not boosted, you might get a little flu symptoms and a little bit sicker. And if you are unvaccinated, you are at risk to go to the place behind me, which is the hospital, and worse. So the biggest message continues to be, please get vaccinated. And we're doing our best in mobile in different ways and different partnerships. The city, Boston's doing great things. So just go out there and get that done if you haven't. That's the biggest protection. I'd say the second, given it's so contagious, Jimmy, we've been using masks like this and cloth and things like that, right? We might want to up our mask game a little bit. We might just want to use common sense. We're going to get out of this. We're already seeing the peak coming down a little bit. But if we just tighten up for another 2 to 3 weeks, just use common sense, mask up. And even if we could get a KN95, which is a little bit better, especially if we're in places with a lot of people, we're essential workers and, we're engaged. So up in the mask game is going to be helpful, I think, here as well. I'd say next, a lot of talk about testing. They just announced a new testing site right at the bowling building. Super exciting, right? So testing is really critical. You do not want to use an emergency department for testing. Our EEDs are packed to the gills, right? There's, find a testing site if you can. And there's community-based organizations who are giving out home tests as well. So, point I'd make about testing, we got the PCR, which we've been doing. Get a swab, takes you 24 hours. And, that picks up particles and amplifies them. So we know, we can make the diagnosis of COVID. If you got a little bit of symptoms, a home test is excellent. Picks up a little bit of protein. You can do it at home, follow the instructions. So testing is going to be critical, but please don't go to the emergency department to do that. I'd say, there's a lot of questions about, hey, I'm positive. What do I do? The bottom line is that I kind of see this as a green, yellow, red kind of, green light, yellow light, red light, right? Green light, a little bit of symptoms, sit tight at home for 5 days, if you're asymptomatic, right? Isolate. You don't want to give it to anybody else. Mask up.
Can I ask one question? Because we know what asymptomatic means.
Yeah.
It means no.
Yeah, asymptomatic means I got it. I have some of my patients who, maybe have a sniffle and they tested and they have COVID, right? So asymptomatic means barely any symptoms, not things like fever, chills, cough, body aches, so asymptomatic may be like, feel like I have allergies, or I got a little, cold, or I have nothing, right? So in that case, you're going to isolate for 5 days, mask up to protect your family, and then mask up for 5 days as you go out. We do believe it's good, if you can, to do a home test before you really go out, and I'd say, the workplace, you want to talk to your employers about what their policies are. There's a lot of different policies here around, when people could go back to the workplace. So just double check on that. And again, I think that when I say green, yellow, red, I mean, green is no symptoms, sit tight, protect yourself, protect your family, and then get back. Yellow is a little bit of symptoms, same thing, isolate, get back out with a mask, maybe test out again with home antigen test before you get out. That's great. Red, now's the time where you got to call your doctor and you got to consider coming to the hospital, right? Cough, fever, chills, shortness of breath. We've known this for a while. So I want people to think about that, because, we're in a battle right now in the hospitals. We are swamped. And in so much as we could all work together with our communities to know when to access us, how to use us the right way, how we partner the right way, it's just going to be better. I'll end with this, Jimmy, real quick. The good news is we have therapeutics on the way. They're scarce, but they exist, and they're going to be less scarce soon. And we really want our community to make sure that we are not left behind with the therapeutics. They include monoclonal antibody infusions and or subcutaneous injections. Fancy word for saying, if you need more antibodies, we got them. We're going to give them to you, and they're going to help you fight the active infection. There are certain criteria for when you would get it. You have to be older, you have to have a chronic condition, obesity. So, people will get more information about the conditions. But if you're getting sick and you have any one of these conditions, we have a treatment. We will have a treatment for you. There's also going to be an oral pill, kind of like Tamiflu, which we take for the flu. So if I get the flu, I can take a pill. It just decreases the amount of days that I have the flu. Paxlovid will do the same. And that's going to be available, I think in a more robust way soon. I don't want to get too far ahead of this, Jimmy, because the therapeutics are not that available yet. But I just want to start to socialize, just make our community familiar with therapeutics, hear about it, study on it, and don't get left behind. So I've touched 5 points here, Jimmy. I don't want to, take up all the time, but I think these are real critical points. Happy to answer, any questions you may have, but I just wanted to message that out to the community.
There's a couple of things. One, I'd love to work with either Natalie or Dr. Alabre to actually get what you just captured in writing.
Yep.
So you can put it on the website and Facebook.
Great.
There is a dedicated Your Healthy Java page coming in the background where you can go watch all the videos. But I wanted to ask you, Dr. Betancourt, you're a member of Mayor Wu's COVID response task force.
Yep.
You mentioned the word policy. And without getting too deep into it, there is a policy within the city of Boston where there is a mask mandate. And so can you just very quickly talk about the importance of the mask mandate indoors? And again, just reiterate the fact, first that point, and then I'll go to the second.
Yeah, look, the bottom line is we're all tired of the masks, myself too. But we have now the most contagious variant of COVID. So every little bit helps, all right? So masking indoors helps, and even a better mask can be more helpful. It's just common sense. So I hear you. I know we're kind of frustrated, but at the end of the day, when I go work out at the gym, I'm going to mask up. Why? Because I just don't, I want to just protect myself and protect others. So sit with us a little bit longer. We know we're asking people for patience, but the mask mandate just makes sense. Nothing is 100%. People start to trip about, well, but mask this, mask that. Look, we're just trying to do every little bit. And if you do little things along the way, and they add up. And so the mask is one of them. And it's a common sense policy. It's not unique to us. And we see it in different places around the country as well.
We also wanted to reiterate the fact that as of this past Saturday, you do, in order to go, as you mentioned, the gym, in order to go in bars and restaurants, and I believe I may have missed one, but you do need to show proof of vaccination, of at least having one vaccination dose. And there's an infographic that we can put out that there is a progressive tiered approach to this policy. And so we want to thank you for your service with that, along with what you're doing at MGH as well. Dr. Betancourt needs to go see a patient around 9:30ish. And so we talked about the availability and awareness of information. We are demonstrating a practice of health equity. And so Dr. Betancourt and Dr. Labrie and I are going to talk about this more later. When it comes to health equity, how important is it that there is dual education from the medical industry into the community, but then there needs to be some education from the community to the medical community as well? And can you talk about, from that title, the impact of health equity? What do we get out of that dual communication?
Yeah, so health equity is essential, and people get caught up in a lot of fancy definitions. I keep it simple, right? We want communities to strive and thrive, and to be healthy, and not just kind of say, oh, people should be responsible, but give them responsible options: parks, good food availability, safe environments, good housing. Right? We cannot do health without that. And so when we talk about equity, we need to understand that the inequities that we see are built on a foundation of structural racism policies and practices over history that have created, quote unquote, the other side of the tracks that we're now kind of, swimming against. So ultimately, from a community-based standpoint, we want to lift up communities. Now, we cannot do that alone. The amount of Black and brown doctors like me are limited. So we try to do our best to move this work, but we constantly say this needs to be a participatory process. We need to enter community with humility. I have in my mind the things that I think we should be addressing in the community. At the end of the day, we've learned time and time again, the community might say, it's actually, where my garbage gets picked up, how this gets done, how that gets done. And those are lessons that we've learned, over decades. So we can find common ground. And I believe that that's essential to health equity. Similar here, I want to make sure anybody who comes in this hospital, no matter who they are or where they're from, gets the best we have to offer. And that will often take different paths, but I need to listen. I need to learn. I need to understand your experience. I need to have policies and practices to support you getting the best. And if you're not getting the best, I need to know about it. And we need to fix it quick. You can't manage what you don't measure. So those are some of the philosophies that we're bringing and principles that we're bringing. And I'd say the big differences between the last couple of years and decades ago is that people didn't prioritize this. People didn't put it up front. And people didn't execute, meaning take seriously like goals, timelines, milestones, accountability, like we are doing now. Not just us at Mass General, but a lot of places across the country. We're lucky in this city to have a lot of leaders who care deeply about this. And I'd end by saying that, we need to collaborate. Health equity and addressing disparities are not something any of our health systems should be competing on. We should be collaborating with each other to address these big problems.
One of the things that you're also doing, and I'm aware of it, is that Mass General has taken a different approach to training and training physicians. And so from the training to aesthetics of your waiting rooms in demonstration of when there are paintings. And so can you talk a little bit about the training and some of the deeper things that we may just take for granted, but someone walking in a hospital and seeing a painting by a Black and brown person on a waiting room wall says a lot, sir.
Yeah, no doubt. So look, I think what we've finally been able to do, and not just us here, but I think a lot of places, but we're really doing it in a big way is, this isn't about 3 things, Jimmy. This is about 100 things, right? But we got to do them all. We have to do them all, and we have to do them deliberately. So whether it be looking at our policies and practices and clinical guidelines and figuring out how they are disproportionately impacting certain people based on race or other personal characteristics, that's hard, not sexy work, but critically important. Whether it's training, and I like training, but training is nothing if you just teach me something and I'm not held accountable for doing what I've learned, right? So training is part of a whole set of things that we're aiming to do that are supported by policies, practices, clinical support, so that it says if I train you on something, you got to do it. You got to make some commitments. I'm going to hold you accountable for that. And so we're training people, yes, around the history of racism, yes, around the impact of disparities, yes, around better ways to communicate with people, build trust, create meaningful relationships. There's a lot. And I think we need to be committed to that. We're a learning profession. We launched a new sickle cell disease treatment center, which we're excited about. So there are new areas that haven't been given attention that we're trying to focus on more robustly. And certainly to your point, we need to get more Black and brown doctors, nurses, frontline staff, across our hospitals to better engage and represent our community and create a space that feels welcoming. And that's not trivial. Whether you go to the cafeteria and get some food that identifies with you in a healthy way, but is culturally relevant, whether you walk into our hospital today and come into the Yawkey building and you see a painting by pro-Black called The People's Heart, and a whole bunch of different things we've done with Dan Chande and the People's Heart Project to simply say, our environment isn't just nice, it's healing. It creates healing when you see yourself, when you feel valued. And it's not just for our patients, it's for our community members, it's for our staff. So that environment is really important. And we need to continue to advocate for policies that make us a better society. So, this isn't about we're going to do 1, 2, or 3 small things. It's big, it's ambitious, but this work calls for being ambitious because we've been underperforming in the space for far too long.
Dr. B, I'm trying to stay together here. And if Dr. Labre was on, I would hear him go, uh-oh, because he could tell when I'm getting ready to get into it. And so I love that you talk about when we come in to the hospital, into the environment, and the satellite places. I've seen commercials that MGH is opening up a couple of new spaces, I believe, out in Central and Western Mass. But one of the things that Dr. Labre and I are going to talk about this is, and it's a passion of his, and you all have been doing it, but we met where? Where did we meet originally?
Yeah, we met Nubian Square, and we're there, and we've been there, and I'm there as much as I can, and I think it's important, and I'll tell you that even if we don't have a care site there yet, and we will advocate for more care sites in community, we want to have a shingle there because our community and our relationship with our community will only be built on this sense that you're here always for the long haul for all our needs, and we can trust you. And that's the type of meaningful relationships that we're trying to create. And we've been there with mobile. I had a Santa mask on during the Christmas parade through around Roxbury, Nubian Square. We're there, and it's our community. We're in this together. So I think it's critically important to me. We're going to do more and more in that space. I guarantee you that.
And I'll get ready to wrap up with this because patient care is always first and foremost, and we'll let Dr. Labre pick up with the education. But just if you could reiterate as we get ready to transition with Dr. Labre coming on, how important is it that, yes, the information be made available, entities have to overexert their outreach, but where does a little bit of the responsibility fall on us as patients and as people? How important is it that we make our care a priority?
Yeah, I think it's essential. But what I always tell people is when you've been treated poorly, and now I come and say, come be a partner, without saying, look, we have done, we as a healthcare system historically have not done well by you. I enter in this relationship with humility to learn. I want to earn your trust. I want to be your partner. You need to expect certain things from me. And hopefully I can expect certain things from you. It may not be day 1. It may be day 2, day 5, day 10, month 3. That's my goal. I think we can obviously work better if we work together. And that's why we're here. Jimmy, that's why we're with you. That's why we're in community. That's why we are trying to build these relationships. Because, we don't want this to be a one and done. We're trying to create a new and better future together where we could all ask more of each other, all ask for more compromise and all create a better future together in partnership. Again, I just end by saying that I understand that me showing up in community and saying, be a better partner is not the play because, we need to earn that given our history, right? And that's what we're aiming to do. But yes, and ideally, we are driving towards partnership where I hear you, you hear me, we work together. If you do 2 or 3 little things better, we do 2 or 3 little things a little better. Over years, those start to add up and we can achieve health equity. And I think it's okay for us to all expect things of each other, and we should.
I appreciate that, Dr. Betancourt. And Dr. Labre, I didn't know if you had an itch like I did, and I need to look at you and say, uh-oh, but I wanted to allow time just for you two to engage for a couple of seconds before you pick up the conversation about the importance of health equity via education and awareness of information. And so, Dr. Betancourt, I know you have to go in a couple of seconds. Dr. Labre? Come off of mute for 1 second.
Sorry. Yeah, I'm not sure I have too much to add. Were you asking if I wanted to add something before the
Not necessarily add something, but I know that you and Dr. Betancourt have an awesome relationship. You have your own passion with
Right.
education. This is one of them. And so just want to allow you some time. I'm very sensitive to my guests when they wait background and allow some time to.
Oh, yeah, sure. Yeah, I think a lot has been said. I think Dr. Betancourt's sort of position and ability to sort of work on the policy level, obviously, there's a lot that needs to be done. And he's obviously been doing a lot of work, both sort of hands-on, but also at the policy level to allow for these things to take place and not just, I think one of the things he's mentioned some time ago when I listened to him was sort of moving to actions and just sort of be done with the talking part. I'm not really sort of putting in the exact elegant words he did, but basically the idea is just we need to just get boots on the ground, I think was one of the words he used. And so we're getting there.
Yeah, and I would say, Jimmy, we got to make investments, right? I mean, Claude, I got to meet Claude. Claude performed incredible service for our, employees during COVID, going down and educating them, in Haitian Creole, right, in a way that they could understand so that they could protect themselves, right? And we got to know each other, and I know this is his passion. So we support his time to do this, and we support this platform, and we will continue to do that. And we're doing the same thing with Dr. Flores and Dr. Ponchos up in the kind of Chelsea Riviera area for Spanish-speaking community. So, you can't just make this about chance or good fortune. If you care about it, you have to invest in it and put people on it. And I think Claude's going to be able to do that. We're going to grow this, learning with you about and learning from the community. What can we do better? Is this the right set of conversations? Let's grow. But that's entering that conversation again with humility, wanting to learn, but humbly sharing, what we know that can help you and help you help us help you. Right.
That's right.
That's what we're aiming to do. And those investments are real and we care about them deeply. And so this is just the beginning, but I think this, having Claude with his commitment to health education, us being able to find and engage people at a level they can understand is going to be really critical.
This is the key thing here. We'll end with this, Dr. Betancourt, as you get ready to go see your patient, as a testament of this. That's wonderful thing coming through this pandemic is partnership. And that's something that you've exuded from our conversation in the beginning. So Dr. B, thank you so much. I appreciate you. And I agree that I mentioned it, Dr. Alabre and I talk. Shout out to Natalie and Pearl and Cindy and everybody and Damien all in the background that help contribute to this. But we are going to grow and we are going to make it better. And just one last thing for you. Good morning, Java family, Dr. Betancourt and Dr. Alabre. Blessings to you all. Thanks for the info and stay safe out there. So Dr. B, we'll let you go because it's 9:30 on the dot and patient care is the #1 priority. So I appreciate you, sir.
No, I appreciate you so much. I love your Healthy Java. I love Java with Jimmy. I love following you. I think you're doing amazing work. So this is a dream to be able to come together like this and to have, Claude and our team support this. So we're in, man. And I hope people, see that we're being genuine, that we're doing this because we care, because we do care. We care a lot and we want to create a better future in the city and beyond. So, thank you, my brother. I appreciate you, and thank you all for tuning in. And I'm going to put you in great hands here with Dr. Alabre, and I really look forward to coming back and talking some more. So I wish you all a wonderful day.
Absolutely, Dr. Betancourt. Thank you so much, and we will definitely talk soon.
All right. See you all.
Bye.
So, Dr. Alabre, you often, when you hear me get to a point of passion, I can hear you go, uh-oh. And so I'm today, you all might hear me go, uh-oh, to Dr. Alabre. Last week, you and I had the opportunity, sort of after the fact, to really, really check in. There was an importance and an urgency that Dr. Betancourt and the MGH team wanted us to get this up and running because we started out talking about COVID. And so in last week, we got to talk, and I really got to, and I see it, I've seen it for the past couple of months with you, but I really want to check in with you about what drives you in this education space. Dr. B just alluded to, you went down to the ER and you used the wonderful skill set of being bilingual, trilingual, because medical terminology is a whole nother language in itself. But tell us, and we did this a little bit in the beginning, but tell us about you when it comes to health education. What drives you, sir?
Yeah, I mean, there's a lot of factors. I think I'll give you a little story, which is really sort of the last push, I think, for me. I've been interested in health education since before med school, and then certainly strengthened in med school residency and whatnot. It is part of what I believe is going to help us sort of bring about more health equity, because knowledge is key. We've always known that. And how we do it, how we deliver it makes a difference. For example, again, going back to that story, was I was doing some Q&As for employees at the hospital when COVID started, just sort of letting them know what it is, what's going on, what to expect, and whatever we knew at the time. And it wasn't that the information wasn't being disseminated before that, and it was still ongoing at the time, but how it was being done wasn't always accessible. And that's where the equity piece comes in as well. So there, and I know Dr. Betancourt talked about trust, and so that was the big factor. Who's delivering the message? Are you trusted? Can they, because obviously there's lots out there. And so trying to get the right messenger was a key factor. And then how it's done. We have a lot of inequities in access. We do things certain ways just because we think that's the way it should be done, or that's what we used to, but it's not always what people use. Say, sending out emails doesn't always work for lots of people who may not even have an email account or don't use it. Or sending out messages in complicated language that people may not understand. So, I mean, you can go on and on about all the different reasons why people may not get the information that they need just to protect themselves. And so the very first or second information session I did, some of the questions were just really just astonishing. I think one of the first ones was about, we're not being told anything. We don't know what's going on. We just see the doctors doing things, and we're sitting there. We're coming in to either clean rooms or bring food to patients. We did all of sort of sessions with food and nutrition, environmental services, and they really had no information. I mean, it's scary stuff. Everyone's sort of masked up, shields, and they don't know what's happening. And again, the information was out there, but was it accessible to them? Was it being put out in a way that they could understand it, access it, and all? So that began to sort of lead to the sort of, we need more education out there, and we need to do it better. And then we also had the issue of just history, what used to happen. And when the vaccine came out, and again, lots of people said to me, and the biggest one I'll tell you was an employee who said, I'm ready to get the vaccine, and I would show up to get it today if only I could be guaranteed I will be given the same vaccine they're giving the white people.
And that's real, Dr. Alabay.
That's right there in the hospital. At an institution, a nonprofit, health-oriented, to have that level of distrust still going on in 2021 back then, and still today, obviously, it was still just like mind-boggling. It's like, wow, you don't even trust your own employer, you don't trust your colleagues, you don't trust, and you can't blame the person, obviously, like we said, there's history. And so, the education piece became very critical at that point, because we really had to get the information out there and get it through what we now call at MGH trusted messengers. Again, people who can identify with the person bringing the message to them, or people who have had some level of interaction, some trust building going on for years. And so this is just one small piece of what this whole undertaking is about. We have obviously the community van that goes down in the community and does outreach and talks. And we're also, unfortunately, it's sort of a double-edged sword. The pandemic has sort of gotten us to a point where we're really devoted to this work, but at the same time, we can only do so much because we can't get out there so much. We can't gather. And we've talked about this. I mean, the hope of this platform is to also get out there in the community and start doing in-person interactions. And we're hoping we can learn about the community and learn about people's worries and concerns and questions through the Q&A platform, because we want to hear about everyone. But it also will be a whole different ballgame when we can get out there and meet people where they are and not just waiting for them to come to us, or the people who don't have access to Facebook or YouTube or what we're using currently. So that really, again, those stories, I could tell you a million of them, but they've all sort of really strengthen the passion to make sure people are getting the information that they need to better their health and care for themselves and protect themselves.
We're going to take questions in just a couple of seconds. I'm going to come back and prompt you for some more of who Dr. Alabre is, but we're going to switch it up a little bit. And we want you in the comments to let us know, how do you get health information? And so please put that in the comments as well. There is a lot of exchange going on in the comments. And so we'll go back around various things, ideas of equity. There's an idea, Dr. Alabre, that the federal government, if they need to get more Black and brown doctors again, how does the federal government work with paying off student loans and whatnot? So there's so much in this equity. There's so much in this equity conversation. And so I want you all to put in the comments how you get your health information. And then also maybe if you want to put a couple of comments about how we can improve here with your Healthy Java. And also what are some topics of which you would like us to speak about. So Dr. Alabre, it was surprising to me to hear that. And I heard the same thing that you observed, that right there in the hospital, where you have the trusted resources and where there's a rapport and familiarity, there was still that level of mistrust. So the historical context is real. You said something a few weeks ago that I really need to figure out how to get the clip out and get it promoted. But you talked about, or it alluded to the fact that there's been time and there is more, though we need a lot more. There's a canyon for improvement. There are I don't know what the right word is. There are enough of you are familiar with enough of a amount of Black and brown nurses, doctors, research scientists that have been involved with this vaccination and the research. And so can you speak a little bit to that when it comes to your confidence in the education that I'll just say that you're aware of and doing, because some of our higher ups in CDC, they're getting it together, but we have people right here on the ground like yourself so can you talk about that education piece?
Right. I think part of what you were bringing up is a key information that is not always disseminated, or because people may not know that's important to this community, to Black and brown people. Because I had brought up the fact that there were more Black and brown participants at the research level for this vaccine, and at the both from the science part of it, but also the participants, people who volunteered to get the shot when they were checking for safety and efficacy and everything else, than many, if not any, prior studies. So that's not something that you're going to see on sort of major news network or even other big trusted sources of information, because it's not something that some people may think is important. But when you're talking to someone who is having a hard time trusting that this vaccine is for them, again, given historical context, as you mentioned, it is really important. I had people who changed their mind the minute that they saw a Black person show up to talk to them and say, I got the vaccine, because they really didn't think that people were getting it who would have their same sort of attributes or
in the beginning,
their concerns are.
In the beginning, there was misinformation, not only about the vaccine. Remember, in the beginning, there was some misinformation about levels of melanin.
Right, exactly.
And so then when Idris got it, everybody said, oh, we can get it. So I just wanted to draw that point.
It makes a big difference. And again, both because, and some of these are valid because we are also learning that there are some differences in ethnic groups in terms of how you respond to certain medicines and how you respond to vaccines and whatnot. And so people need to hear that information, that it was tested in people who look like them and not just a vaccine that was made out somewhere that they have no connection to. And now you ask them to just go ahead and, be guinea pigs. But, once they start to hear that this is not being guinea pigs. This was tested on your people. And we also contributed to the research part of it so that we're not trying to go back to whatever year when things were being done without taking into consideration lots of attributes, again, for certain ethnic groups and minorities. And so these were on the table at the time this was being developed. And it's been in the consciousness of a lot of the researchers and the policymakers that everyone really participates in. We didn't quite reach the level in terms of, we talk about ideally having 14% blacks in this country. Everything would be done with that same level of percentage where, at least a quarter or less blacks would participate in the study. But we got pretty close. And we believe that's good enough for this vaccine, let's just say. And so again, part of this sort of work here with Your Healthy Java is that we can also hear those concerns. And I heard about the concerns from doing Q&As in sort of groups. And then we obviously began to talk more about it and bring it to everyone's consciousness that this is something you can trust. If we don't have that communication that you mentioned, something, was it neutral?
Dual education exchange.
Exactly, dual education is that we need to get educated about the concerns, the questions, and they are as valid as anyone else's concerns and questions. And until we hear the questions from the community, we can't address them. And once we hear them, we can also figure out the best way to address them and hopefully get that sort of two-way communications going. And
we're kind of doing that right now. Some of the things, and I want to a couple here might cause Dr. Alabri for me to get to look at him and go, uh-oh. But one of the things that I see, and if I make a comment, I'm kind of messing and not necessarily picking on anyone, but I seen a comment here. I get the information by any means necessary, traditional and non-traditional, which is real, because there's osteopathic. Did I say that right? Medicine. Yep. And herbalist, type. And so Sharon, thank you for sharing that. Another Sharon, Cornelia shared, I get my info by word of mouth, sometimes the news. Mm-hmm. And so with word of mouth, and not just with Sharon, and especially, Doc, we're just going to keep it real. Dr. Betancourt set the tone. A lot of Black woke folks are getting information that is not just wrong, but it's detrimental. And I think Stacy put up a comment that the lack of mistrust, kind of different comment, but the lack of mistrust had many people not getting the vaccine and they died. She said, Selah. But how dangerous is it to get any type of information, but health information, from a wrong resource? Because there's this thing called clickbait on the internet. Mm-hmm. It's messing us up in politics. But how much more so is it important that we get accurate data, science data-driven information from the professionals and not some random website that they copied from Dr. Sebi and sorry.
Yeah, no, I mean, I agree. People should be able to get their information the way they deem most appropriate, that works for them. And we understand that people get information through word of mouth, through the internet, through reading the news or listening to the news, YouTube and whatnot. So that's not going to change. We're not trying to change that. What we're trying to change is the quality and the trustworthiness of that information.
Okay, thank you.
And so, yes, and part of the reason we're doing this is also because we realize that in 2020, 2021, 2022, people are on the internet a lot. People are on Facebook a lot, and people are getting information that way. And this is not what we used to do. I mean, medical information 10 years ago was basically you had to go to a conference to go sit in a room with, lots of people with shirt and ties and vest and, and people didn't have access to that. And so we have to evolve as time changes to also get the information out in the way that people are getting the information. And so that's why we're using Twitter more and more, Facebook, YouTube, and all that platform to get the information out. The tricky part, again, is who's giving you that information? Who do you trust to do that for you? Because we know how much is out there and what are they based on. And so people need to realize when you're getting that information, if someone is telling you something, you get to take a step back and say, where is this coming from? Where did you get it?
Yep.
And why would I trust you with that information? Again, I can also obviously say, why should you trust me or anyone else who comes on this platform to talk? But we do have one step above. We actually are trained medical professionals who are working at a trusted institution that has set standards for who can actually work there. There are licensing bodies, the state and the credentialing offices. All these are in place for that very reason, so that when you're hearing stuff from people who have gone through that process of assuring credibility, they're telling you what is consensus information, science-based information, fact-based information. If you choose to listen to someone with no credentials, I mean, that's question.
Look, I'm getting ready to go. Because Dr. Labre wants to say one thing, but no. So let's stay in that vein for a second. One, thank you for the clarity around the fact, because I didn't want that comment to be disparaging, because I oftentimes go to Google, go to research. And so you clarified trustworthy, and what was the other word? Trustworthy points of information. You used two sort of descriptors. Trustworthy. It may have been accurate.
I'm blanking on the other one, but I think
we can go back and look at it. But the thing that I appreciate the fact that you did acknowledge the fact that we use the models, but it's the trustworthiness. The other thing, Dr. Alabre, and this was one of the main things, and Dr. B does it. You don't know what an impact it had on people watching now that will spread the word about this platform. For them to hear you say, keep it 100, why should you trust me? You know what I'm saying? And that is the type of transparency and the cadence that is needed for people to at least stop and at least listen. And so that's why I thought it was so important today for people to hear from you, with all due respect, because you worked hard to get those two letters that's sitting behind your name. And if anybody's listening from Harvard, up this man's associate professorship very quickly. But I said that. And so it is important that people see and get to know you away from the white coat, to get to know you away from the stethoscope. Value all the work that you did for that MD, but it was important for people to get to know Claude. You know what I mean? Because I heard a cadence from you when we talked last week, and I was like, oh, this is it. And I had confidence, but I had confidence in Dr. Alabre. But as of last week, I had a familiarity and even more confidence in Claude. And you know I say that respectfully, sir. Not taken away from all the work that you've done to gain that wonderful title. But it's real, Dr. Alabre, that people, Sharon and some other people put some comment about the distrust. Where do we get? Because oftentimes, when the information is accurate, we still can't get out of that sunken place of the history. So how would you suggest? Well, let me go check some questions. We'll end with a question to you, and we got about 9 minutes. Or if folks have questions, I'm going to troll them. But how do you suggest that someone that is on the cusp of trusting and whatnot, how do they begin to get out of that sunken place of distrust? Big question. It's a general response, but I feel compelled to ask you that.
I know. I think it's difficult for sure. One of the sort of ways I can sort of mention this, or I could advise on this, is it an opinion? or is it consensus information? And obviously, there's always going to be opinions out there. But when it comes to health, to science, do you want to trust that person who is coming up with his ideas, her ideas out of nowhere? Or do you want to trust the people who've actually put in the work, taken the time, and you know, we use big terms like peer review and all that kind of stuff. And really all it's saying is that it's not opinion based. It is fact based. It is consensus information. And we use our words carefully, and we talk about people who are going out there, say from MGH, to talk to people, to bring out information. We actually refer to them as messengers. And part of the reason we're using the term messenger is because it's not just coming from that individual, it's coming from the institution, the higher ups. You know, we talk a lot here about the CDC, and the reason we mention the CDC a lot is that we're referring to that body with the authority to do that kind of work, to give that kind of information. And so when I'm faced with someone who may have an idea that is slightly different than what we believe in, and what I ask is, how do you back this up? Do you have anything to back it up? We can tell you, you know, the number of people who participated in, again, this is, the pandemic is the sort of hot topic. We can use that, and there's lots of other information out there, but we can use the pandemic for now. You know, we have studies to look back on to back up what we're saying. But if you just wake up and feel a certain way about something and you think you go and disseminate, and we've seen this, you know, we talk about the horse pill and ivermectin and urine, and you know, you just have to go, can you back this up? How many people tried this and actually came out of this from drinking urine? Like, I mean, it's crazy to think that someone would just come up with that stuff and someone else trusts them and follows in their footsteps.
We're to you and us, you know, and again, getting to know Dr. Alabre, he's bewildered by the fact, because his orientation to getting information is what it is. Dr. Alabre, because of time, the thing I wanted to extract was, what is the detriment of misinformation? You talked about staying in the context of COVID and the vaccine, because Stacy put it up earlier. And while Sharon, this is a valid point, and this is why I asked about getting out of the sunken place. The history, and Dr. Alabre has named it, it is real. But we're in different times,
right?
Different people in these. I'm sorry, because I feel that.
No, it's real. And again, we're not infallible. We have to remember this. I'm not saying this is always gonna stand. We may find out at some point some of these weren't fully 100%.
And being real, Dr. Alabre,
being human.
But it's also a novel virus. Can you explain the term novel? It's and this is the thing I think we forget. Novel means new. We've never had any virus like this before. And so I'm sorry. I just
no. That you're right. And part of it, and even beyond being novel, beyond being new, years could pass, and we have to remember again, we are still human. There are probably things we will find out later wasn't quite as we thought. But at the time when that information was being given, it was the best we had.
The benefits outweigh the risk. That's a term that you often use. And not saying that there aren't risks. We're not saying that ain't real. But the benefits, as you have said often, outweigh the risk. So one, thank you again for acknowledging that we are human. And when man comes to anything, there is room for error. And so that mixed with novelty I think I found myself here presently at a point to drive the fact that don't let that cloud of valid, real past of what has happened to us as Black and brown people to allow us to experience the same detriment, but in a different manner. We'll still suffer, but Dr. Labrie.
I know. And then we remember, you might remember this, one of the sessions we had here when Dr. Peterson mentioned, we've been left behind for 400 plus years. This is a time to get ahead and get to the front of the bus, not just sit back and say, we can't anymore, because a lot of work has been put into getting this information to be valid, to be trustworthy, to be equitable. I mean, we can't just sit back and and lament, or we
Stay
get
in the past. Will, let me just say this. While the past informs the present, and it must be considered in future planning, what's at present right now seems to be very much different to help inform the future.
Right.
Dr.
And yes, the consequences are dire. I know you've read this up a few times. We haven't talked. I mean, we're seeing it. The ultimate price, really.
And Sharon, I'm going to go there and we're going to wrap up with this point. Racism is not new or novel. Representation matters. We need Black medical authorities at every level, and they are getting there. They are. And that's something to remember, but we can't let our lives get lost in this for something that we'll never forget. And we must acknowledge the last Tuskegee Airman that passed away, I believe, this weekend, since Sharon named that. So we want to name that. We're talking equity. But that's the thing that we got to Sharon's point, people are in those positions. And so it's a much, much different time. Validate the past, be woke in the present, but don't let it limit your future.
That's awesome. Well, Jamie, I like that. I really
we have a dynamic that we after the show, we talk about, oh, Dr. Labrie, you made a statement there. Dr. Labrie, thank you. In Even the Just, and you know that we do this often, that when we're talking serious issues, it's important to have these times of just, because it is very weight. It is a lot of weight on us to move this. So I didn't really see any questions. I saw a lot of comment. But at any point, you all can go back and comment. You cannot inbox me, but email info@JavaWithJimmy. If you have continued questions, if you have ideas for shows, like I said, Dr. Labrie and I met last week, and as Dr. Betancourt attributed, this is going to grow. It's been amazing, but it's going to grow. And once we're able to get outside, y'all will be able to come either to the underground or somewhere, and you'll be able to meet Dr. Labrie and others from MGH. Oh, hold on. Asia said she asked the question earlier. Asia, hold on, because if you asked the question when hold on, I'm going to go look up. Asia. Dr. Labrie, is there anything that you would like to reiterate or that we may have missed in this important conversation about equity, as well as okay, Asia. So Asia, this isn't something that we can MGH can answer. I will get a few text out or emails to a couple of folks. I understand that home testing availability is interesting generally. I know the federal is
and actually, while we're talking here, let me see, I have a resource that I just found out. Let me see if I still have it here. There's a website that was developed just like we had a website for the vaccine that was telling you where they're available. Now you can actually go on and it will tell you where the home tests are in stock and where they're coming in.
Can you type it in the private chat and I'll cut and paste it? We're doing this in real time, y'all. Education. But no, Asia, thank you for raising that. I thought it was important just to make sure I didn't miss any questions. So Asia, thank you. I seen your name somewhere else. Too many quoting books published in the early 1900s. The authors and opinions uniform are outdated. Okay, Asia. Tell us how you really feel. No problem, Asia.
We want to hear it all.
Pastor Marion, you asked a question earlier. You all know that at certain points I don't look over here because this thing, you all go. I mean, but remember, Dr. Labrie, I said last week that there are full-fledged separate threads of conversations that go on in Java with Jimmy. Pastor Marion, do you mind just asking it again? And we'll. Oh, here it is. She asked, "Is it true that if you've received the Johnson & Johnson, that you don't have to get a?" I can almost answer that as not being a medical provider. Yes, you still need,
Jimmy.
huh?
All questions are good questions.
Yes, no. What I'm saying is that the Johnson and Johnson. I'll let Dr. Alabre answer after he.
Sorry, what was the question? I was typing the word.
The question was about Johnson and Johnson specifically, and what Pastor Marion asked was, hold on, let me go back to Lord Jesus.
If you get the Johnson and Johnson,
don't have to get a booster. Is
that's the opposite. Actually, the booster is needed even sooner.
His face. Yeah.
So the recommendations are, if you got the mRNA vaccines, you get a booster 5 months. It used to be 6 months, now 5 months. After that second shot, you get a booster. But for Johnson and Johnson, it's 2 months. The protection wanes even faster, sooner. So right now, we're really encouraging everyone to get either the Moderna or Pfizer booster if they got Johnson & Johnson first. And you are eligible to get that starting 2 months after receiving the Johnson & Johnson.
Okay.
Don't wait.
Get it. What did you say? The vaccination and healthcare is available.
It matters. Get it where you can. Yes. Go get it where you can. I put up the websites.
Yep, I just put one up, and I'm going to put another one up that you sent, but I can only pin.
Yeah, the second one just takes you directly to that page. The first one is the main website. So,
so that's the one that I'll pin. All right, so if you're seeing me post from Java with Jimmy or YouTube right now, I'm going to pin that comment to the top for the last couple of minutes that we're here. You can click that website and go and find out where the information is available. Hold on, let me see if it is my I put it in the private chat, Dr. Alabre. Let me go put it in the comments. Natalie is also saying, shout out to Natalie Johnson. It does some work along with others in the background. You will also be able to order home tests beginning tomorrow for free. So I believe is that the website that we're referring to?
So this website just tells you where they are. That's for stores, like where you can get it. The one Natalie is referring to is the federal.
That's the one I saw on Twitter.
Home testing that's limited to a certain number per month and all that stuff. There is information there starting tomorrow. You can get it. Okay. I don't have that exact website myself. I don't know if Natalie has it.
We're gonna if you give me 1 minute, I'm gonna go to Google right now and we'll put that link in there as well, because this is important to get that information out. Fed website for home tests. Oh Jesus, I left the sound on here. All right, here we go. So some of these websites, okay, how to get your at home. I trust cms.gov better. I'll put this one here for now. You may have to do some navigating to get Dr. Alabre. Oh, there it is. Michelle, thank you. This is the website. www.covid. Now, just when I went to search in Google, ads, when you Google, sometimes ads pop up first. Pay attention to a couple of things while we talk about education. Please and I'm pointing at the camera like they can see me. Oh God, I got to get some new stuff where I can do a little laser pointer. HTTPS means that this is secure. And if you see HTTPS with a .gov, that's a site that you can probably trust more than some others. And so, Natalie, thank you so much. She'll send one later, but Michelle put one in as well. Thank you. And Aunt Connie, Auntie Java, that's where I saw the federal one. So thank you, Auntie. But because you don't have iMessage, I can't cut and paste off of my Mac here. Shout out to iPhone. All right, Dr. Alabre is looking like he needs to go take care of something. Listen, oh, you're good? Okay. It was so important.
Again, we know this matters. This is one small part of what we need to bring about health equity, but we can't neglect the information piece, the education piece, because a lot of it is about not knowing or having the wrong information that can obviously lead you down the wrong path. And as we mentioned before, the consequences can be quite dire. And so we definitely want to make sure that if we are going to make health a priority, it has to start with the education piece.
It is definitely important. Dr. Alabre, thank you so much. We're going to end this segment with the resource. I need to go make some announcements, but I'll let you go. I just want to go back and thank Dr. Betancourt for coming in today. And our next, and Dr. Larber, I want to check with you. Our next subject scheduled for February 1st is around healthy matters when it comes to sexual activity as we approaching Valentine's Day. But it's also Black History Month. And we were talking the other day, how do we, in this space, do something around Black History Month? And so stay tuned. It may not be a Tuesday, but I may tap into some folks at MGH to have a conversation away from a Tuesday morning, just in context of health and Black History Month as well. And Dr. Labrie, I'm getting this in real time. It might be worth having a session around the changes of getting from, I'm getting this in real time, moving from history to something, because the history is definitely real, but moving from real history into I don't know, moving from history into treatment. We'll figure out something, but just keep that in mind. But Dr. Alabre, thank you so much. And Sharon, thank you. I love our ability to exchange and share information and build upon one another. So thank you. And one more piece of information: federal government 4-limit test per household, and look that up online. All right, Dr. Alabre, I appreciate you, sir, so much. We're scheduled to talk next week, but we can check in before that. I'm sure we'll text after this, because this was one of those sessions. But I appreciate you, sir, so much. And I was glad to be able, I got to hear a cadence from you, and I thought it was so important that the audience does as well. And again, you know, hopefully this will be one way that, as you highlighted, why should they trust you? And hopefully today's session gives them a different lens in which to view your sincere and informed approach to making sure we have health information and education. And so I appreciate you, sir, so much for it.
I appreciate you, Jimmy. This is awesome work you're doing.
Thank you. And it's awesome. Y'all going to hear more from Dr. Alabre. He does more than just sit on here and talk with me. There's a whole vision he has around outreach and education. And so you'll hear more. We're going to figure a way how to support it and do more with it. So Dr. Alabre, I'll let you go. And I'll go do some announcements, and then we'll see you in 2 weeks. But we'll talk. All right. Thank you, sir. Appreciate it. That was one of our best Your Healthy Java sessions. Stacy, thank you for being a part. Pastor Marion, thank you as well. Sharon, again, thank you. Ma, I know I'm talking trash about androids. I want to just make some announcements to everyone, and know your eyes are not playing tricks on you. We're just about to go and switch things up a little bit and get to this announcement stage for Java with Jimmy. So we want to let you know that, okay, where is this thing? Okay, there it is. That tomorrow morning, we have the privilege and opportunity of bringing into the room one of the gubernatorial candidates who is running for office, in the person of Sonia Chang Diaz, who is currently a state senator. She is running for the governor's office, and she will be with us tomorrow morning at 9 a.m. So please plan to tune in there. I am going to ask her about, if she was governor, what would be her approach? What would she do different around COVID? And what would she do right now when it comes to schools and remote learning and the economy? And then on Thursday morning, we have the privilege and opportunity of also speaking with the Honorable Representative Elizabeth Miranda, who is currently the 5th Suffolk District State Representative, also running for office for the candidate for the 2nd Suffolk. And then also, though we don't have a flyer ready for it, also coming up on Monday, Dr. Brandy is coming back into the Java Cafe, and we're going to begin Mental Health Mondays. And there's a very, very different perspective that Dr. Brandy wants to take, where we're going to hold each other accountable when it comes to some of the work that will need to be done. And I'm just trying to get this right graphic queued up for the sheriff. I think I got it right this time, because the other day I've had the wrong name on it. But Liz Miranda is coming in, and then next week, and it's still the wrong one. Next week, we will have Dr. Brandy on Monday. On Tuesday, we have Bobby Constantino. Bobby Constantino was just released from the DA's office. We had Rachel Rollins on a couple of weeks ago. She's now the U.S. attorney, and we knew some changes were coming to the DA's office. Bobby Constantino had a very important role there. And so he's coming on Tuesday. On Wednesday will be Steve Tompkins. And then on Thursday, Quincy Roberts from the city of Boston, the liaison for the LGBTQI plus community. He's working on a project called Beyond Pride. He will be with us on Thursday. Oh, and another thing I need to let you all know about is Darren Howell will be with us Friday morning at 9 a.m. for Freestyle Fridays. So we got a lot of content planned for you over the next couple of weeks. I'm trying to stay 2 or 3 weeks out of planning. And so, very last announcement today. Just do me a favor. If you remember the name Tanisha Sullivan, please go into the comments and let me know if you remember the name Tanisha Sullivan, because I'm about to share something with you all today that is very interesting. If you follow me on Java with Jimmy, you will probably see it. Hold on for 1 second. I just want to make sure that we share this today. For those of you that did not know, there is someone that we know. Well, obviously, I said Tanisha Sullivan. Tanisha is running for office, y'all. So let me get
as
this
a young girl sitting in a hair salon owned by the president of the local NAACP, I listened and learned.
Hold on for 1 second. We're going to get this queued up and let you all see this wonderful announcement that was made this morning from our wonderful, what I call Madam President, and if everything goes her way, soon to be Secretary of State for the state of Massachusetts. Ladies and gentlemen, and it just was released at about 7 o'clock this morning, and it's already at about 7,000 views. Here we go.
My life has taught me to believe in what's possible. As a young girl sitting in a hair salon owned by the president of the local NAACP, I listened and learned as women strategized to address the issues facing our community. My parents inspire me in service. My dad spent nearly 40 years working in our public schools, helping young people understand what's possible through hard work and belief in yourself. And as a business owner, my mom supported other small businesses, helping them achieve more together than was possible alone. These influences ignited my fire to serve, and that fire led me to the University of Virginia. And my passion for a career that centered helping people achieve their dreams led me to Boston College for my law and business degrees. As an attorney in the private and public sectors, community service has always been at my core. And in the footsteps of my childhood shero, I became the president of the NAACP Boston. I've never shied away from tough issues. Believing in what's possible, working with others across the ideological spectrum, I've delivered policy change to help improve quality of life for all of us. And the past few years have caused me to reflect on the tough work we still have to do, the stagnant problems we still have to solve, and the fights we still have to win to strengthen our democracy. My name is Tanisha Sullivan, and I'm running for Secretary of State. I'll champion policies to protect, defend, and expand voting rights here in Massachusetts and across.
There you all go. Tanisha is running for state secretary. So shout out to her for doing that. I already reached out to the team, and we're going to get her scheduled. We'll have to figure it out because, again, I'm booked about 2 weeks out. So we'll figure it out. But shout out to Madam President Tanisha Sullivan. Don't forget tomorrow, Sonia Chang Diaz, who is running for governor, will be with us. And then also on Thursday, State Representative Elizabeth Miranda. And then on Friday, Darren Howell for Freestyle Fridays. And we'll update you about next week. Just the other quick update. I said that I see merch props. We're going to announce merch. But so a couple of things are coming down the pipe. And I want to be very strategic with advertising it and how we do it. So I'm mentioning this. They'll be made available, and we'll do more we'll get more details out about how you can purchase. A couple of things are happening. One is you will be able to get a Java with Jimmy, the latest edition of the Java with Jimmy mug, filled with different variations of chocolate for Valentine's Day. You can purchase the mug and give it to someone, a loved one, for $15. The other thing that we're going to sell, and then is on deck right now, are the Java with Jimmy hoodies. I got to check into some logistics around Cash App, because I was just informed the other day, even through your personal Cash App, if you do business, the IRS. And so I need to make sure that I'm set up in a way to capture that stuff. So we have the red and black Java with Jimmy hoodies. And then also, we are going to have custom made designed by yours truly in collaboration with Props and Katie. We are going to have available 2 different scents for you to buy a candle to give to your loved one for Valentine's Day. It's an 8-ounce candle, and the 2 scents that we are offering you, the first one is oh Jesus, Props. What was the name of the first scent? Jesus. I got to go back in the text messages. The second scent is called Flight B6 1519. The first one, Props, text me real quick, Jesus. Where is it? Oh, we have 2 scents that are going to be made available to you. These coca, there he goes. The first scent that's going to be featured is called 7th and Peachtree. The second is going to be called Flight B, and Props don't remember, Flight B 6 1519. And so you will be able to buy 2 scents from Java with Jimmy. So I'm going to get ready to wrap up off of here. I don't know what's going on with the computer. Could be because of my hands making the light change, but see, it did it again. I don't know what that is. I'm getting off of here, everyone. So we'll have mugs available with chocolate for $15. Hoodies are available for $44.99, and the candles are going to be available for, what is up with the color thing here? The candles, the sun is coming out. I'm like, hold on. Let me turn the light down. The sun is, I'm sitting up here looking like, what the heck is going on? So we'll have the mug available with chocolates. We'll have the hoodies available and also custom-made candles. These candles are made from a soy and coconut blend. They are home handmade candles. And I've learned about the fragrance load. I have requested that the fragrance load be a little bit more than recommended. So when you burn that candle, it'll permeate through your home. 7th and Peachtree, Flight B6 1519. We'll give a descriptor. 7th and Peachtree is sort of it has a pomegranate, lemongrass with sort of a grapefruit undertone, very clean, fruity. And then Flight B6, Props will have to remind me what that one smells like, but I believe that is a combination. I forgot. We'll get the information out. Y'all have a wonderful day. I'm getting ready to go so I can eat. And got a couple of things to do this morning. We'll see you tomorrow at 9 a.m. With gubernatorial candidate Sonia Chang Diaz. Yes, Auntie, we are going to have candles out for Valentine's Day. And Miss Jeannie, good to see you. Love you too. Good to see you. I know you have a birthday coming. I need to respond, Jesus. All right, folks. We'll see you tomorrow at 9 a.m. Thanks for tuning in for another episode of Java with Jimmy, your community-driven platform. Peace, everybody.